have once asked yourself, what is a TBI? A traumatic brain injury, otherwise known as a TBI, is a brain injury that can be caused by a forceful bump, blow, or jolt to the head or body, or from an object that pierces the skull and enters the brain. These injuries range from mild, such as a concussion, to severe and life-threatening. Most commonly in modern media, TBIs are shown as a consequence from contact sports. However, this video will illustrate that anyone can get a TBI, even from doing relatively daily and normal activities. A quick disclaimer, while it is possible to get a TBI from daily activities, it is not common. However, if you do bump your head or fall, it is always wise to contact your doctor or nearest emergency room for help and support. This is Siena Rivera. While walking home from class one rainy morning, Siena tripped on wet concrete and landed face down. The first thing she described was a black screen. She admits that she must have lost consciousness, but only for a few seconds. After regaining her consciousness, she found herself on the ground with shattered glasses and a broken nose. She remembers all the details, having never had a consistent amnesia from the fall. On her way home, she noticed that her balance was quite off and that her speech was abnormal and flighty. She decided to have her mother take her to the ER that night. At the ER, she was asked many questions and given a neurological exam. From there, they ruled out any severe brain trauma and diagnosed her with a concussion. Even days and weeks went by with no symptom improvement. One major cognitive ability she noticed suffered was her concentration and attention. Her academic success plummeted, and she confessed that she had to drop out of university and even quit her job because of the significant side effects. She wasn't able to walk long distances due to her vestibular balance being damaged and required the use of a cane. Siena scheduled a meeting with a brain rehabilitation clinic. She was given a variety of neurological and physiological exams. They decided to diagnose her with post-concussion syndrome and started treatment as soon as possible. Post-concussion syndrome, or PCS, is a diagnosis given after a certain period of waiting after a concussion. This diagnosis is given when symptoms persist past the waiting period. To aid in her recovery, she started seeing a neurologist regularly who was able to help with medication management and imaging. After several months of hard work and treatment, she was able to re-enroll in school and has since been successful in her studies. She states how enthusiastic she is about her ability to finally walk without a cane again and be able to talk fluently. Without rehab, she states that she wouldn't be able to have gone back to school or continue pursuing her life goals and dreams. Siena is just one of many who has suffered from something as severe as a concussion. However, hope is there for anyone who has. TBIs can change the lives of those affected. If you or a loved one have ever suffered from a head injury or TBI, please seek support and care. Things can and will get better. Thank you for watching.